All right, welcome to another episode of Vital Doc Talk. And today we have Dr. Brooke, and she's a phenomenal doctor. We've already started talking for like 30 minutes, and then I was like, man, we got to get back to that episode. So she's a leader in her field because she actually runs a meetup for other doctors, a group, and then she's built her practice up. She's a veteran. So Dr. Brooke, welcome to the show.
Thank you so much for having me.
Awesome. Well, awesome to have you. Why don't you give us a quick background?
Yeah, so I've been in practice for 15 years up here in Redmond, Washington. I own Alpine Integrated Medicine that's been open for about 10 years. We are a multidisciplinary clinic with a bunch of naturopaths and acupuncturists, and we do all kinds of alternative medicine from primary care to IV therapy and ozone treatments, biohacking, bioidentical hormones, pretty much anything that would be in the alternative sphere.
That is awesome. And, 10 years, I'm sure you got a lot of gold to share for us and probably not even enough we're going to be able to get in on this episode. So guys, keep your ears open for the end on how to connect with her and her practice. So Dr. Brooke, what's kind of been your favorite way to grow, or actually maybe even before you reveal like what's your favorite way to grow today, what were the different things you kind of tried in the past and maybe failed on?
Oh man, I have spent tens of thousands of dollars on paying for advertisements, whether it was in various magazines or news, radio, TV. We've looked at everything. We've done a lot of events. We've gone and done tabling. We've kind of done all that. And I can say that the thing that has worked the most for us is focusing on outreach to our patients in a good quality way with material that people want, rather than flooding people with information that they're just going to delete or skip over and not even read. And optimizing our website using SEO to help people identify that they even want our services and identifying the keywords for that. And word of mouth. If that has really been the way that I've built my practice, is providing great care and then getting word of mouth referrals.
I love that because, here on the Vital Doc Talk, as I always like to say, marketing channels, of course they matter, but relationships, they matter the most.
Absolutely.
And that's really what we're building at the end of the day anyways, relationships, right? You're using that SEO, which is what we love as well, obviously. And you're using that to get a form filled, but that form fill is a person. And that's where the real magic happens. And so which was like kind of the biggest waste of time that you would say, doctors, do not do this. I, wasted my time on this marketing channel and it was a complete bust.
Magazines.
Wow.
I would say I spent the most. I'm not going to name the magazine specifically, but some local Washington, Seattle magazines that I spent a lot of money on. And number one, they actually got my ad completely wrong and put it in the wrong month of what I purchased. And then they tried to make up for it, which I actually got a bunch of free advertising for. But honestly, we keep track of where our patients come from, and we never saw a single patient from that marketing. And that was probably the most expensive thing that we did.
That is tough to hear. And that is why I actually do not like traditional marketing sources as much, because most of them, radio ads, whatever, it's hard to see. But we've seen some traffic spikes from the radio, granted. But I think if you're using a traditional source and it's not digital, even if you're using digital, tracking is so important, right? So today, I would say, what is your favorite marketing source that you recommend to most doctors?
Word of mouth, and I think recognition of your brand. I think having a brand, having something, what do they say? You probably know this more than me, that people need to see your logo 7 times or hear your name 7 times before they recognize you. We, are here up in Redmond Ridge, but I live in Duval, which is just about 6 miles down the road, and it's a very small country community, and we are the platinum sponsor for their big June festival. They do a big parade, and we've been platinum sponsors for the last 5 or 6 years, and it's only been in the last year or two that people are coming in and we're saying, hey, how'd you hear about us? Like, oh, I've seen you the last couple of years at the parade. I've seen your banner up, and time for me, to start coming in. Or people are putting us up on Facebook now, recommending us, and like, oh, I recognize that name or that logo. So I think it just takes time. And I think you have to be patient and you have to be diligent. You can't give in too soon. You have to be willing to put in that time and make sure that people see you 7 times.
I love that. We don't talk about that familiarity effect. luckily I had a bachelor's in psychology that I thought it would be useless, but yeah, that's called the familiarity effect actually. And
Yeah.
the more familiar something is, the more you actually like it subconsciously. And I think that definitely applies in marketing. And at the same time, you mentioned something awesome, which you said putting out content that your audience wants. And the first thing I'd ask if I was a doctor is, how the heck do I know what the hell my audience actually wants to hear, right? Like, how do I know they'll delete this email versus this other email, you know?
Yeah, well, there's lots of programs out there. I think we use Constant Contact for our newsletter. And
Mhm.
so that is a program that allows us to see how many do we send out, how many people open the newsletter, and how many clicks go out of the newsletter for any, hyperlinks that we put in there. So we've been able to track, the names of our newsletters. And, just for the fun of it, one time I did a newsletter on bioidentical hormones, and we said something about, let's talk about sex. And that newsletter got 53% opening of over 3,000 ads or emails that went out. And that was by far our most opened newsletter of years. And so
Wow.
sex sells, right? And so that got people to open it up. So being creative in your titles, putting things that are pertinent to the times, and again, not overloading people. We have done a newsletter every month, more or less, since we've been open for 10 years. And I have all that in a collection. We have it up on a blog so people can search it. And with coronavirus right now, we have tried to put out more content directly related to COVID-19.
Hmm.
Instead of doing a newsletter once a month, we're now doing something once a week, but it's pertinent and people want the information. And this is a time that people are stuck on their gadgets, whether it's their iPhones or their tablets or whatever. And so people are craving good quality content. And you, meaning the provider, the doctor right now, someone's trusting you with their health. And so the content that I put out right now is going to be taken a little bit more seriously when I put it out versus something that's put out by a media outlet or something like that.
100%. Yeah. Especially, context obviously matters. And in today's time, a doctor's voice is, really powerful, and people really want to hear what doctors have to say.
Yeah.
Are there any specific questions you think doctors should ask themselves or maybe their audience in terms of getting information for what type of content to put out? Obviously creativity matters. So, one thing I've heard is from you so far is the question of what's relevant today. Is it Easter? Is it, coronavirus? What's going on in the news? What are the major hashtags and trends going on? And how does that impact health? Any other questions you think people can or should ask?
Yeah, I mean, you can search that stuff. You can, again, there's so much with social media now, you can see what's trending,
Mhm.
and so you can really get an idea of what people are looking for.
Mhm.
And then just asking patients, like for me at least, I try and develop that relationship with my patients to say, what kind of content would you like to hear about? Look through my newsletter. What is the thing that you're wanting to know about? We also look at what's happening in the news. What month is it? Is it Breast Cancer Awareness Month? And so we can talk about that more. We try and do what's pertinent to our patient population. We don't see a lot of pediatrics here, so we might not be talking a lot about, pediatric or MMR vaccine when that all happened last year. But we talk about it in the context of the parents and why is it important to know for their kids, right? So finding what's pertinent to each individual patient is important, but then being able to deliver that content in a way that is informational, that is accurate, that is not fear-mongering or bringing up things that are controversial. People are looking at to us as doctors for facts. And that is, I believe, our responsibility to provide those facts and not something that's biased from my point of view. So
I love that, and that those are fantastic tips, because I think it is all out there and you have to just do your research. And then also, I don't know why I forgot, but one tip I thought was golden for me personally in terms of content is keep track of what you're talking about with your audience, with your clients, right? With your patients. And then basically those questions they ask, that's what you want to write about, right?
absolutely. And sometimes we'll write something and people will be like, hey, what about this? Can you talk about that next time? And, I have a running list and we try and make it pertinent to the times. We try and, if it's not, maybe it's not something that goes in my newsletter, but that's where we might do a blog post or something might pop up in the news on an article, and I'll post the article and I'll write a couple of sentences and comment on it. So I think the thing for your listeners is not everything needs to be a 2-page article. Sometimes writing 3 sentences about something pertinent in the news is enough to grab someone's attention and to engage them.
I love that. That's great. And it sounds like you've done a fantastic job building up your brand, staying engaged in your community, having the patience to actually do it. Because I talk to all these, rookies out there, and they're like, "Hey, $500 a month, I'm ready to do $1 million." And it's like, that's not how it works.
Right.
And then what kind of major setbacks did you face as a doctor that maybe you didn't think you would face? Or obviously Corona is an easy one to point at. And then how have you overcome them?
I think a big part of it is meeting patients where they're at. You have to know your demographic. You have to know your socioeconomic class. Doing your market research of where you put your clinic. My first clinic was in downtown Seattle, and I was a brand new doctor among 100 other doctors for a very small radius. And so to set myself apart, I had to really try and find my little niche. And so I think it's really important, especially for naturopaths, to have a niche. You can be a primary care doctor, but you have to have something that sets you apart from other people. And it can be a lot of various different things. It could just be what you specialize in. It could be your approach. It could be doing things like marketing and just doing it better than everyone else out there so that people find you. And again, that kind of SEO, if you search for a lot of different keywords in Redmond, my clinic is one of the top clinics that comes up because honestly, we do it all the time. And what I mean by do it all the time is we Google our name. We Google Dr. Redmond, we Google naturopath Redmond, we Google headache treatment Redmond. And so you have to think not as a doctor when it comes to marketing. You have to think as a lay person. You have to think what words someone will look at to get treated, because not everyone knows what IV therapy is or what biofeedback is. So we can't use terminology that we as doctors are familiar with. We have to learn what the patient is searching for in Google.
I love that. And that's 100% correct. Right. And I talked to my orthodontist actually like a while back, and it's been over 10 years. And I asked him for his advice, and he said, the best thing you can learn is to put yourself in the shoes, the other person's shoes,
Absolutely.
And learning how to think like your patient. And so I think, that goes right along with what you're saying, where, if you don't understand how they would say something, then that's really where you got to do the extra research. So that's gold.
Right. You have to have 2 different ways of talking, in my opinion. You have to have your medical terminology that you are able to converse with your colleagues, but you also have to have the way of communicating with the lay person that you don't sound too important. You don't have to, that's part of the reason why I go by Dr. Brooke, right? It's about me being on the same level with the patient and not being superior to them. It's about me doing what I can to get them better, and they have to understand what they're doing, or else they're not going to get better. And, in naturopathic medicine, docere, doctor is teacher, is one of our fundamentals. And so it's a really big part of what I do. And what I think is why I'm successful is because I make sure that patients understand what they're doing and why they're doing it, rather than just saying, hey, do this because I said to do it.
Yeah, that especially in today's age, right, where everybody can do research, et cetera, and they're going to question everything. Yeah, they're going to Google everything you say. So I love that, Dr. Brooke. And what would be kind of one actionable tip or takeaway? I'm sure doctors out there, they're thinking of 30 things they have to do on their drive to somewhere else, or maybe most people aren't even driving today anyways, but they're thinking about their dog in the other room that they've got to feed, and their family, and all these patients complaining. What would be like one quick tip you think they should utilize?
I think, again, the biggest way that I grew my practice was word of mouth. So I think that the one tip that I try and give every doctor that walks through my clinic, every preceptor, is that you have to not be afraid to talk about what you do, number one, but number two, ask for referrals or testimonials. And it's not the thing you do the first time they're in or the second time they're in, but when they're in on the 4th visit, or maybe they haven't come in a couple of months, and you called to check in on that patient, and follow through is a really big tip I can give to people. But when they say, oh yeah, you did XYZ treatment and I'm totally cured, I didn't have to come back. Right? That is a huge testimonial for you. And you want that person to write that up and say, be like, hey, I saw all these other doctors, and I saw Dr. Brooke 2 times and haven't had to be back. I mean, that is gold, and you can't write that yourself. Someone has to write that for you. So asking patients to do testimonials and to refer their friends is, is huge. And I think understanding why people don't ask for referrals and asking yourself why. Do you feel like it's pompous? Do you feel like it's you kind of tooting your own horn? It's not. We're here to be doctors to make people better. And if people don't know what you do or who you are, then you can't help them.
100%. And thank you so much. And you gave some really actionable things in there as well. Don't do it on the first or second time. Maybe if that's too much for you, do it on the third time or fourth time you talk to them. And then also, if you find them saying, "Oh, I'm totally healed," that's gold. So thank you so much, Dr. Brooke. You were phenomenal. A lot of great content tips and engagement tips for the audience. Where can people find you?
Well, you can reach me through my website. It is alpineintegratedmedicine.com or aim for the number 4 healthnw.com. So aim4healthnorthwest.com. You can also reach me at my email at drbrooke, that's Dr. Brooke, at alpineintegratedmedicine.com.
Awesome. And that's another episode of Vital Doc Talk. Thank you guys so much. Awesome.